Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm also the inventor of advanced soft tissue release ASTR specialty. I am a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR.
So Marghoub, tell me what's going on with your shoulder. What happened?
When I'm moving my shoulder, I have painful.
How much pain from 0 to 10? 10 is emergency room.
It's 5 to 6.
5 to 6? Can you show me the motion that caused the pain? Like lift it up and tell me how much pain?
They have the painful thing like this.
5 and 6 in there?
No, it's going more.
Like how much from 0 to 10? 8?
9.
Okay, can you bring it back like this?
Yes.
How much pain with that too?
This time no, there's no pain.
No pain?
No.
Okay. This motion, and what else is difficult for you to do because your shoulder pain?
This, they have the painful.
Okay. Can you bring your arm back here?
Yes.
Okay.
It's, this time no pain.
Okay. But when you do it straight. So how long this been going on? You can relax.
For 3 months.
3 months. How did you hurt your shoulder? What did you do?
I don't know this when I'm suddenly I feel
Suddenly no falls or injury or anything. Have you had any treatment for your shoulder before coming
not
here?
yet.
Okay.
I'm back salon pass and cream.
Okay. But you still feel in pain there?
Yeah.
Okay. So what else is difficult for you to do? Lifting stuff or taking your clothes off? Do you have problem with that?
Yes, when I remove my shirt and
When you take off your shirt,
take off
okay?
my shirt,
Okay.
it's hurting.
It's hurting. At worst, how much from 0 to 10?
It sometimes it's going 8.
Uh-huh.
Normally it's 5, 6.
Okay. All right. So we're going to take the range of motion for your shoulder first, and then we'll do the treatment, and after that, we'll assess you.
You know,
Okay?
yesterday they gave me the injection.
Okay.
Still I have the pain.
So you had injection, and
Yes.
yeah, and you still having pain.
Yeah.
Okay. All right. So what kind of injection did you have?
I don't know that.
Okay. All right. So we'll take have you. So stop as soon as you feel pain. Okay.
Okay.
So this is right shoulder flexion. Okay. So straight arm up and stop when you feel pain.
Start the pain.
You see 125, almost 120. 1 second. Okay. 130. You see that? Get the whole thing. 130 flexion. And we're gonna do a shoulder abduction. Okay. So bring it up toward your ear.
They have painful now.
Painful?
Yes.
It's 125. Okay. Oh, it's actually 132. 130. You see that? Get the whole thing up. 130 abduction. So we're gonna do internal rotation. Okay. So bring it down. That's normal. It's 90 degrees. That's fine. Okay. External rotation. Let's see how far we can get. Get the whole thing. So this is 70 degrees. 70 degrees external rotation. Okay.
Crop this out.
So, do you feel your pain in the front, the back? Where do you feel the pain?
This is the back and
In there. And what kind of pain do you experience? Sharp, dull, aching? How do you describe the pain? How do you describe your pain? Is it sharp pain, dull pain, aching pain? Stabbing? Yeah. Let me know if you feel any pain. So you have this because of the injection?
yeah.
Okay, is it okay to take it off?
Yeah.
Okay. As you see, I cannot take it off. Sorry. Okay, I made it. Okay. Let me know if that's painful, okay? Any pain with that, or it's okay? Okay. So it just happened randomly, you know,
Yeah.
no injuries or
No
anything.
injuries.
Okay. You diabetic?
Yeah.
Okay. Do you have high blood pressure?
Yeah.
Okay. Any other medical history?
No.
No. Okay.
Maybe surgery for prostate.
No, you had surgery, prostate surgery. Okay. Anything else?
No.
Okay.
Giữa hai cái động tác này, cái động tác này đau hơn.
Make sure you're not feeling pain, okay? Is that painful or is it okay? Sorry.
Ngồi ngó cái không cho nó.
Is that painful now or it's okay?
It's painful little bit now.
Sorry. Okay. Make sure this is not painful. Sorry. Okay.
Không nặng cái không nặng mà nó lên lúc mà lên nó thì cấn chút.
Sorry. Okay.
Bởi vì còn nó đau quá đúng là như 6 bao.
Năm tháng trước 6 tháng tới cái này
Okay, so I'm gonna work on your scar tissue. You're gonna feel cold, okay? You feel this bump here? That's a scar tissue here. You feel that?
Yeah.
Is that painful or it's okay?
It's okay.
Okay, sorry. And you said you feel it in the back too? Okay.
Giờ 5 cái đó.
Sure, I get lotion in your clothes.
Next one left. Okay. And he doesn't have any or X-ray has them. Oh, really? That's where it's going. Oh, thank you.
Okay, I want you to set up for me
Which is a Tuesday.
and turn around. Okay. Let me do the back a little bit here.
Yes.
Is that too much or it's okay?
You're welcome.
Alright. Okay, can I get a towel, please? Oh, thank you. Oh, you multitask. It's like the videographer. Oh, she's waving her hand. Okay. Say hi.
Hi.
Okay. Can you see her? No.
Oh. Hi.
All right. Okay, let's lift your arm up and see the range of motion. How's that? Any pain or it's gone?
No, I have little bit.
How much from 0 to 10 and where?
4.
You feel 4 out of 10. Where do you feel the pain?
Same.
Okay, so let's actually lie on your back. It's here in the same position. Lie down. Relax. Relax. Relax, relax. Is that painful? Sorry, sorry. How does it feel? Make sure it's not painful, okay? Any pain? You're making some faces. Make sure you tell me, okay? You see, I can read your mind, you know? You gotta be careful. Is that too much? You get a big knot here. That's a big scar tissue. Okay, I'm just doing this for the camera. It's not the best ergonomic, but you guys don't do that at home, okay? Is that painful?
A
Little bit, okay. Make sure you let me know, okay? We don't keep secrets in the camera, okay? Okay. Yeah, you got a big knot here. Well, definitely, as you see, I'm making a big mess here. Okay, so let's set up and we'll try it again and tell me how that feels. Is it pain or it's gone? Like front view. How's that? Are you trying to show off now?
Yes, it's better now.
Better? No pain? Beautiful. Let's take your range of motion again. So lie on your back. Oh, Barry? We'll get to Mr. Barry. It's over there. Okay.
Okay,
Okay.
say let's take the range of motion.
So let's actually take the range of motion. How much was the flexion? Flexion 130. Okay, so the flexion 130. So bring it back as far as you can. Pain. Yeah. That's good. Okay. So this is 165. Okay, let's do abduction. How much was abduction?
130.
130. Okay, so let's bring this up and toward your head like this. Yeah. So that was 130. Okay. The camera in the way. Okay. So that is like 178. 178, 130, 178. That's good. Okay. So I know that the internal rotation was normal, so we don't need to take that. Let's the external rotation, how much it was? 70. Okay, so let's bring this back. 70. This is 90. Oh, more than 90. That's perfect. Don't have. Here you go. You see the numbers? 90 degrees.
Nice.
All right. Okay, sit up. All right. So, what do you think about the treatment? Just working on your shoulder for a few minutes. ASTR treatment.
It's very good.
Yeah. Can you tell the difference?
Yeah, I have so many different.
Yeah, you feel
Before
you could
I
not
cannot
lift your arm.
move this my head.
But now you
Now
move
it's
it.
good.
Yeah. Awesome. Thank you so much.
You're welcome.
Thank you.
Feel free to subscribe to my channel to get updates about helpful information and tips and tricks on how to relieve your pain and your patient pain. Also, there's over 170 videos, most of them actually real treatment videos. I'm showing how I use ASTR instrument on the patient, and you can actually see the result in the video within the real treatment videos. If you are a healthcare provider, feel free to register for ASTR class so to learn how to actually treat your patient effectively. In ASTR class, I actually utilize over a 400 research study. That's actually what I use as part of the treatment, and that's what I will go over with a health practitioner to learn how to practice effectively based on research study. See you soon.